This program is rated PG. It contains themes and scenes which may not be suitable for very young audiences. Parental guidance is advised.
Be advised that the views and opinions of the hosts and guests do not reflect those of the station.
A dilemma is a situation in which one needs to choose.
Paano ako gagaling?
There's an ethical issue.
As
Supposed to help first or
Medical Dilemma.
Hi, I'm Sonny del Rosario and you're watching Medical Dilemma. Happy New Year and welcome to the new season of our show. The emergency room is where many life-threatening cases unfold, during which medical professionals make split-second decisions that tilt the balance between life and death. Thus, it is a stage on which perplexing medical dilemmas play out, requiring sharp judgment to ensure the welfare of patients are protected always. Joining me for this episode is an emergency medicine specialist, currently affiliated with Makati Medical Center, UERM Medical Center, Providence Hospital, and Mandaluyong City Medical Center, Dr. Daniel M. Luchangco. Welcome to the show, Dr. Luchangco.
Thanks for having me, Sonny. It's nice to be here.
Okay, now for the first segment of this show, let's talk first about some background information regarding the practice of emergency medicine. Okay, maybe you can start by telling us a brief story of how you came to choose emergency medicine as your specialty.
Okay, so when I was training or going through med school, we rotate through all the departments, the operating room, the delivery room, general floors. And I always found that when I was working in the emergency room, that was where I felt most fulfilled. It was exciting, and I felt like I helped people a lot more. So I gravitated towards the emergency room. And then as I finished my training, I found out that there is a specialization in emergency medicine.
Okay.
So that definitely attracted me.
And the development of emergency medicine, is this a very recent development?
Yeah, actually, well, compared to the other specialties, that are very established, like cardiology, surgery, and all of that, emergency medicine is relatively new. By relatively new, that will still be maybe about 30 years already in the Philippines.
30 years in the Philippines.
So it's much more established in other countries, more developed countries. But recently, it's been there's an upsurge in the acceptance of the need for emergency medicine specialists in the ERs.
So is there already some affiliation or association that encompasses the practice of emergency medicine?
Yes, actually, there's the Philippine College of Emergency Medicine, just like there's the Philippine College of Surgeons,
Yes.
and etc. So it's a group of emergency medicine specialists, so those who have trained in emergency medicine and passed the boards and all of that. And that group regulates the practice and the performance of emergency medicine in the country.
Okay. Now, in my mind, if you're an emergency medicine specialist, it sounds like you will have to, know a lot of specialties, maybe something like a jack of all trades. Okay.
Yes.
Is that correct as an impression?
Yeah, yes, that's true. So we do have to see anything that walks into the ER. Just to clarify things, it's not the intention of emergency medicine to take away the practice of other specialties. We're not saying that we can manage these things better than the specialists, but
Yes.
of course in the ER you can't have all of the specialists sitting there waiting for the patients to come in. So previously the practice was to have a general practitioner in the ER, and then they'll call the specialist as needed. But that general practitioner has a very basic knowledge of all different cases now.
Okay.
And we were seeing that in the first few minutes of treating the patient in several cases, there are some things which have to be done sometimes they're complicated, but they need to be done very fast, even before that specialist can arrive. So in order to improve outcomes, we need to bring specialized treatment to the patient earlier. And that can only be done by having somebody there who can do a broad range of specialty treatment procedures.
I see. So how long does it take to train to become an emergency medicine doctor?
Well, so to become a doctor after college is the med school, and then there's 1 year of internship. No? So all doctors train that way. And then you take emergency medicine as a specialization, or what we'll call residency training. No?
Yes.
That's a standard now. It's a 4-year program under the Philippine
program.
Board and College of Emergency Medicine. And then you take the specialty boards to get certified as an emergency medicine specialist.
Okay, now in your experience, what are the typical or most common cases of emergencies that you encounter?
Yes. Well, actually, that's highly dependent on the location and nature of the institution that you're working in. No.
Okay.
So, for example, my main hospital is Makati Medical Center. It's a very urban setting, tertiary hospital. No.
Yes.
So we're in the middle of the business district. So most of the people come in from offices. Usually they're covered by their hospital work insurance,
Yes.
no? Their executive working age. We do get a lot of because they're workers, so they work, so they're more educated, so they have a lot of knowledge already of certain health things. We get a lot of cardiac cases, stroke, things like that. There are other places, let's say government hospitals that are located in maybe very depressed areas or squatter areas nearby. There's a lot more trauma in those places. So people fighting, getting into accidents, stabbing, things like that. No, so I'm also affiliated with the Mandaluyong City Medical Center. No, so there we get more of those cases. No? Also, people in the higher socioeconomic status tend to seek care earlier. Meaning, let's say, konting chest pain lang, you're worried, so you go to the ER right away. No? Whereas people in the lower socioeconomic levels, they're afraid of the costs. No? So sometimes titiisin muna nila kasi if I go to the hospital, mapapagastos ako dyan.
It would go away.
So they tend to let things linger longer. No? So previously, actually, even in Makati Medical Center, we had like a charity program subsidized by the city of Makati. No? And those times, you'd see that the cases you get, no? Sometimes you get someone who has asthma, but he's already in a very severe case or situation when he arrives.
Yes.
No? So because they tried to wait before going to the hospital. So the cases you get in the ER will really depend on the nature, the location, and the kind of hospital that you're in.
What about seasons? Do seasons affect the kinds of cases you get?
Yes, there's also some variety to that. No, well, for example, in the holiday season in the Philippines, no, just from sheer number, so many Filipinos from abroad come back. So the population of the city just gets much bigger
yes.
during the holidays.
Right.
And also it's a season where there's a lot of partying. You wake up early for the dawn mass,
Yes.
and then it's so traffic. Everyone's stressed. You have to go shopping even if it's crowded. You have to go with your family to vacations and things like that. So people tend to get very stressed, and that just exacerbates all the other conditions. Those who are hypertensive, and then with the holidays, the diabetes. You eat sa kanilang yung diet after. So these things, and then even stress itself.
Yes.
Just being stressed will exacerbate all your other conditions. No? So definitely holiday season, we see a surge in the emergency cases. No? So,
Okay. Is the skill set of an emergency doctor very much different from that of maybe a GP, for example?
I'd say yes, actually. So definitely people will study their specializations, right? The cardiologists, surgeons will have certain skill sets. No? So definitely emergency physicians don't have the skill set of, let's say, a general surgeon.
Yes.
But there are some surgical procedures that we have to be able to do. So most just small cuts or something, some that need to be stitched, we
Yes.
do that in the ER. No, we don't do appendectomy, but we'll repair wounds. Then we have to be able to do resuscitation, for example. So somebody's heart stopped, so definitely that's a cardiologist specialty. But we can't wait for the cardiologist. We have to be very skilled in resuscitating a stopped heart. So,
Yes, yes.
so there are just pockets of skills, but throughout the spectrum of medical specialties that we have to be able to do on the spot.
I see. Okay, Doc. So we'll have to take a break at this point. Don't be leaving this channel. We'll be right back after a few words from our sponsors.
comes out of my mouth, especially in such a place where anything can spread like wildfire.
When you share something to a public, you find that experience, and that experience so rich it could change other people. Okay?
Like, there are other senses, right? So you hear it, you see it, and then you can smell the fireworks.
Now put it to the game by asking where are the practice.
Word here what next to words can inspire and words can destroy. Choose yours. Okay?